Welcome to The Game. This is the show that we go play-by-play analyzing the game of politics. Today, we're going to look at a decisive vote on Obamacare. Democrats are putting all their money on Obamacare subsidies, while Senate Republicans are looking at healthcare savings accounts as a solution to the problem of affordability. At the same time, we're going to take a step back. We're going to look at the bigger picture. Why is America's healthcare system so complex, so difficult to fix? Then we're going to go to the city of Miami, where Democrats have won the mayor's race at a time where it's been almost 30 years since they've been able to win it. Joining me here today to discuss these topics is Dean Clancy. He's the Senior Policy Fellow at Americans for Prosperity. We also have Kevin Garcia Galindo. He's the Policy Fellow at the Libre Initiative. Thank you both for being here today.
Our pleasure.
Thank you for having us.
Yeah, thank you both for being on the show. Let's get right into it. Dean, I want to start with you. Everyone is looking at what the Senate is doing later today. They're going to be voting on the Obamacare subsidies. The Obamacare subsidies have been the main point for Democrats. It's why they say they had a government shutdown. It's why they say that they've been fighting for the affordability. But I want to ask you directly, what is your perspective? Is the Obamacare subsidies a viable solution for the current topic of affordability around healthcare?
No, the Obamacare subsidies do not make healthcare more affordable. Democrats have made a big stand on the issue, and the Senate will be voting on it today. That the 6-week government shutdown ended when Republicans said, okay, we'll let you have a vote on your plan to basically spend $30 billion a year with a B on Obamacare, basically money that would be sent to insurance companies to try to buy down the out-of-pocket cost of insurance for about 20 million Americans in the Obamacare marketplaces. And I think across the spectrum, people realize that doesn't bring down healthcare prices. It just covers the price. It masks it at the taxpayer's expense. But that's the Democrats' position. They say it'll be a crisis if we let these existing subsidies expire on January 1st, as they are scheduled to do. So they want to extend them for 3 years, and that's what the Senate will vote on today, to spend $30 billion a year for 3 years to continue sending that money to health insurance companies, and that's what the Democrats are calling healthcare affordability.
Yeah, and Kevin, I want to ask you, because at the same time, Democrats are saying that, again, this is what they see as a solution. But at the same time, what are you hearing from people on the ground? What are Latinos saying around this topic on healthcare and the Obamacare subsidies? What is the perspective that they hold on this issue?
Yeah, exactly. So the Libre Institute actually this year did a poll which specifically measured across a variety of policy topics what were the top concerns for Latinos over the past year. And what it found was that 78% of Latinos said that healthcare was a major concern for them. And additionally, 92% of them reported that they thought that the healthcare system was sort of subsidizing insurance companies over customers, which is what they would have preferred to see. And additionally, over 88% of them also said that they wanted to see fraud, waste, and abuse tackled. We know from various studies that there is a huge amount of wasted funds in these ACA credits. And so, through Latinos, reading the news and the newspapers and the nightly news, hearing about all these stories, this is something that definitely concerns them.
And Dean, I want to ask you, again, the Republicans, I think, are trying to get their footing. And if we're being a little bit honest when it comes to this topic, they found themselves now in a situation where they also have to respond with what they see as a solution. The Senate is also going to be voting on a healthcare savings accounts bill. But as expected, it's also probably not going to pass. Republicans only have 54 votes when it comes to their party. They're going to need Democrats who have not signaled that they're willing to cross over and work with Republicans on this topic. Is healthcare savings account something that would essentially offset what folks are saying would drive up prices? Or if not, what role do HSAs play in this conversation of healthcare?
Well, a tax-free health savings account is a wonderful tool that puts you in charge of your healthcare purchases with a big tax break. It's like getting a 25% discount on every medical purchase you make using the account. And Republicans' idea, and the Senate will vote on this today, as well as the Democrats' Obamacare bill. The idea is, why don't we take some of the money that we're currently spending to help lower income Americans with their health care and just give it directly to them rather than give the money to an insurance company. Give it to you, the patient, in your tax-free health savings account. Then you can use it to, for doctor's appointments and x-rays and MRIs and crutches and over-the-counter medicines and prescription drugs and you name it. And it's really great because with an HSA, you can obtain doctors and care that your insurance company refuses to pay for or does not cover. And so it's more freedom and it's more choice. Well, how does that address affordability? Well, when people are spending their own money, they shop for value because with an HSA, and it's like with your bank account, what you don't spend stays in the account. You keep it. With an HSA, you can invest it, by the way, if you want, and you could actually grow it into a nest egg for future medical expenses. So people are going to shop for value. And when they do that, prices are going to tend to come down because now they're going to ask the price. They're going to say, well, do I have less expensive options that give me just as good value? That's not happening in healthcare today, by and large, because people do everything through insurance. And that's not their fault. It's because of government policies that it's become this way. And when the insurer is doing it, they don't necessarily give you a good price. They don't necessarily negotiate a good rate. They don't necessarily cover the drug that you need, the one that works for you, and they want you to substitute something that doesn't work as well. So with the HSA, you're shopping for value, and you're also getting that discount in effect from the tax break on every purchase. The result is healthcare will be much more affordable for people, especially if we let every American have an HSA. Right now, only about 20% of Americans qualify for a health savings account. That's something at AFP we really want to change. Let's let everybody have the option of a health savings account. The Republicans in the Senate today are saying, let's help people in the Obamacare exchanges. These are lower income Americans. And let's take the money we're spending and sending to insurance companies. Let's put it in your HSA and you decide your health care.
Yeah, very much so. I think that's one of the key things that folks want. They want to be able to take control of their health care. They want something that's affordable, something that's on the good quality side. Kevin, I did want to ask you a little bit of question on the political side of things. We saw the November elections in New York, New Jersey, and Virginia. There was also a Tennessee race about 2 weeks ago. This Tuesday, we had the Miami mayor's race. Many folks are looking at these different races and thinking, what are going to be the topics and what are going to be the messaging points and the issues that voters are going to be thinking through in 2026, where we know that it's going to be the midterms. Majorities in the House and the Senate are in the balance. Specifically, when you think of healthcare, what role do you think it's going to hold in the conversation of elections? Again, it's front and center today because of the votes. Not only have Democrats been messaging on it, but Republicans have also, again, trying to find their footing, trying to find a place. Do you think when you think of next year, we think of 2026, do you think healthcare will continue to be front and center?
Yes, definitely. As you mentioned, a lot of those Democratic candidates specifically ran on the issue of affordability. And there's no sort of, aside from, food and gas, there's no sort of tertiary part of that isn't healthcare. It's a lot of Americans, first or second biggest expense. So in that case, it's really important for the Republicans to be able to afford a plan that makes it really clear what are the ways that this will lower costs for Americans. And I think what's most important is messaging on the empowerment and the choice that something like expanding HSAs will do, and sort of the power to be able to choose your own doctor or go through direct primary care if you wish, and how that's going to have a downward pressure on prices over the long term. So I think if Republicans are able to turn the conversation around, use affordability and talk about HSAs that way, then they have an opportunity sort of to turn the blue tide, at least make it smaller than we would have expected.
Yeah, I think it's true. It's a valid point to say that I think folks, it's going to continue to be in the back of their mind as they're making decisions next year. I think both Republicans and Democrats are going to be messaging on it throughout next year. I do want to turn a little bit, as I mentioned earlier, we are going to be zooming out and looking at our healthcare system. What are the areas that need to be fixed? Why is it that folks are saying that it's not affordable? Why are some folks talking about the lack of quality when over 10 years ago, over 15 years ago, President Obama promised that Obamacare was going to be the fix to many of those problems. Dean, I want to start with you. When you think of what's wrong with our healthcare system, what are the things that are not working and why are they not working?
Healthcare costs way too much, and it's getting harder to find a doctor or a hospital that you trust, that your insurer will pay for. And it's getting harder to get insurance companies to pay for care. And all of this is happening largely because of Obamacare. That bill passed in 2010. It was purely partisan. Just Democrats supported it, no Republicans. So as a result, healthcare has been a very polarized partisan issue ever since.
Hmm.
And under Obamacare, health insurance premiums have tripled. They said they called it the Affordable Care Act, but it's gotten less affordable. Deductibles, that's the part you pay out of pocket before your insurance kicks in, those have doubled. Um, it's getting harder to find a doctor in your network. The insurers are shrinking their networks of doctors and hospitals to save money because of the way Obamacare is designed. The insurers are not villains here. They're responding to bad government policies. And then claim denial rates, where the insurer refuses to pay, have surged. They've grown tenfold since Obamacare started. Now, under Obamacare, 1 in 5 medical claims is denied by the insurer. Some insurance companies denied 1/3 of claims, whereas before Obamacare, it might have been 1%, 2% were denied. So, in general, healthcare has gotten worse in this country under Obamacare. And as we mentioned earlier, the Democrat solution is, well, just do more of the same, spend more taxpayer dollars on it. They have no plan to reform any of or address any of these problems. No plan whatsoever. Yet they accuse Republicans of having no plan. Republicans are saying, let's do something different. Let's fund patients, not insurance companies. Let's let everybody have an
Hmm.
HSA. Let's give people other insurance options that are much less expensive, like short-term plans, Farm Bureau health plans, association health plans. Rand Paul has a bill where people at Costco, Walmart, Sam's Club, they could get insurance through that membership, a membership-based insurance, which is really not allowed now under current law. And you would have the power of group buying there on a vast scale,
Hmm.
and so prices would be lower. So Obamacare has failed. Democrats have no plan. Republicans have a whole bunch of plans. They just need to act on them. They need to pass those bills and get in the game on health care. And then I think you'll see the public shift. Right now, the public trusts Democrats on health care significantly more than they trust Republicans. And I think that's because Republicans have been too timid. They just need to bring their good ideas out there, pass them, send them to President Trump when they can get them through, and or at least run on them in 2026. Then the public will see there really is a choice.
Yeah, it's an interesting point that they've been timid on it because I always like to say that in the absence of good ideas, bad ideas will begin to be elevated. So they're going to need to really take a step forward and lead on the issue. Kevin, I want to ask you if you could expand a little bit on what you see as good solutions as individuals, again, are facing a healthcare system that is not working for them, as companies or even doctors and patients are facing these barriers, and they're saying, how can we get out and be at a place where we have better healthcare insurance quality and that is accessible? What are the good solutions that you think should be elevated in the marketplace?
Yeah, at the Libra Initiative and AFP, we've pushed different various kind of reforms that could sort of incrementally get us closer to a system that empowers enrollees to choose their own healthcare in a variety of ways. Obviously, HSAs, as Dean has talked so much about already, but expanding direct primary care, which is sort of like a Netflix subscription with your doctor, which allows you to have a one-on-one relationship with them instead of having to go through insurers, and a lot of times can be more price competitive when more people are able to choose that option. But also other things like bringing more generic drugs to the market, as well as just relying on other developed countries, health organizations to approve drugs instead of solely relying on the FDA, countries like France, England, or Japan that we trust and we know are reliable. Just all those different kinds of reform put together can really make a dent in lowering the cost of healthcare.
Yeah, Dean, I want to ask you, again, we've mentioned several times here how complex this issue is, not just because healthcare itself is complex, but because of the dynamics that you mentioned on that it's become a very partisan issue, right? Republicans do have majorities in the House and the Senate, but again, you need those 60 votes to get legislation through. In this year, there hasn't been any signals that Democrats, even on issues that they might agree with on Republicans, want to give them any wins per se. So I do want to ask you, do you see any sort of easy wins, any first steps that can and should be taken? It's probably going to be difficult between now and the midterms for Republicans to do a complete overhaul, a comprehensive package on healthcare reform. But are there smaller areas, key steps that they could take, maybe in telehealth, or maybe states could also play a role in this place? So I guess the question two-part is, what are the easy wins or the first steps that Congress can take? And then second part, is there something that states locally can also play a role in?
Well, I think that the secret of passing good health legislation at the federal level right now, where Congress is so evenly divided between Democrats and Republicans, is to move small incremental bills that are hard to say no to, ask the members to vote on them, and then find out, what their real motives are. For example, if you take a small bill that just says that people who are on veterans health care can have a health savings account, which right now is not allowed. That's hard for Democrats to vote against. How do you explain that? Why can't they have the option of a health savings account? And there's a whole bunch of these bills, and many of them have already passed committee or the full House. And by the way, a couple of them actually made it into law as part of the one big bill back in July. There was a provision that allowed about 10 million Americans to have an HSA who are in Obamacare. And people don't know about this, but that was a good incremental reform that actually made it into law. There was another provision related to direct primary care, which Kevin was talking about. It basically said you can use your HSA tax advantage dollars to pay for your monthly direct primary care subscription to your favorite doctors. And as he said, it's like Netflix. It's a monthly subscription. It's very affordable. And you get this great one-on-one relationship with your doctor where your doctor's available to you much more and spends more time with you. We have studies to show that it produces better health outcomes, and people spend less. They go to the emergency room less often when they have that relationship with their doctor. Well, the one big bill removed a barrier to that. And I have a spreadsheet of, it must be 150 ideas. Some of them are quite bold and ambitious, but many of them are small. And telehealth, you mentioned that. Absolutely. And there is bipartisan support for making telehealth more available in Medicare and in private insurance. This is the 21st century. I've had doctor's appointments through telehealth. I'll bet you have as well. It's so much more convenient, and you're not risking an infection when you go to a doctor's office or the hospital because you're at home. And everybody should have this option. And we know from our polling that people really like telehealth as an option, but we have to remove barriers. So there are bills to do that in Congress, and those should be moved, freestanding. So just vote on telehealth. Some of those, like telehealth, can get through, others not so much. You asked about the states. The states, for example, and we've been working on this at AFP very hard, let's remove the certificate of need laws. This is a government permission slip to add new hospital beds or to build a new hospital or to add a new MRI machine. It's really like something out of the Soviet Union where you have to ask the government permission to provide more health care to people in your community. And the reason it's there is basically to try to restrict competition. It's protecting the existing hospitals, the existing providers, and it doesn't make any sense. And in the states where we've succeeded in repealing certificate of need, we've seen lots of new facilities get opened up. We've seen prices come down, more competition. It's just better for everybody. So states should definitely repeal their certificate of need laws. They should remove any kind of restrictions on direct primary care. And they should allow international medical graduates. These are people who have trained to be doctors in foreign countries. Let them come into the U.S. And serve as doctors. They could start out as physician assistants. That's typically how it's done. And then after a certain number of years, they can just practice independently as a physician. And that would help with the physician shortage problem, which affects many parts of this country. That's an incremental form that states can do, and some states have been doing it, and AFP has been very involved in making that happen.
Well, there's a lot of details there that I think hopefully this is an episode and a message that is being heard throughout Congress. That spreadsheet of about 100 tabs, I think it's also very exciting to hear, Dean. I do want to thank Dean Clancy, Kevin Garcia Galindo for being on these two segments focused on healthcare. I'm sure we'll have you back here again as the topic of healthcare continues to be front and center in the mind of voters. Again, thank you both for joining us for these segments.
My pleasure.
Thank you.
And now we're going to turn to the Miami mayoral's race. Now we're going to turn over to the topic of Tuesday's election, where the city of Miami was able to elect a new mayor, a win for Democrats. It is a historic win because it is the first woman, Elaine Higgins, who will be taking the command once she is sworn in. Democrats are claiming this as a big victory on their end. Here to analyze the topic is Orlando Cecilia. He is the founder and senior pollster at National Victory Strategies. Orlando, thank you for joining the podcast.
Thank you so much, Wadi. Thank you for having me here.
Orlando, I want to get started. When you look at this election and you look at the data and you look at what happened, what is the picture that you think we should all be analyzing? Where was the shift in vote that gave Democrats the win on Tuesday?
Well, look, I think the big thing, and you can take Miami as a subset of the nation, although it's not a complete indicative of the entire nation, but it gives you an idea of what's happening. And what we saw is a big shift, obviously, in the independent vote. Now, Miami is a very Hispanic district, city, and what we saw there is a shift in the middle, and that caused this ripple. In space and time, which apparently in 30 years it's only been Republicans, which is true, but it's a very Hispanic district. So what I believe you saw there is an indication of some national issues seeping through into local politics. But in reality, I would say it's not like this whirlwind victory for Democrats that they're claiming, but it's also not something to ignore for Republicans. There's definitely warning signs there.
So on that point, actually, what are those warning signs for Republicans who are looking at the city of Miami, right? A place where Ron DeSantis did well with Latinos, a place, Miami-Dade as a whole, where President Donald Trump was able to win historic numbers in 2024. A year later, here we are, but where history has almost changed towards Democrats. What are the warning signs that Republicans should be looking at?
Yeah, I mean, look, the biggest warning sign is you see the middle, right? For typically in politics, and I don't think we're seeing anything different. You got the left is on the left, the right is on the right, and you have that group in the middle, which shifts back and forth, and that's really who decides elections. And that's what you're seeing now, or what you saw at least happen here in Miami, where it shifted, I would say, dramatically. Our numbers have it in the ranges of 60 to 20, 25, let's say, where it shifted left, as opposed to, I think historically would be more in the range of at least 55-40 to the Republican side. So you're seeing that move. And I think it's a byproduct of national issues seeping into local issues. I think the reality is people's pocketbook is what dictates a lot of this stuff. People will overlook a lot just to be, if you take care of their pocketbook. And I think we're seeing a little bit of a squeeze at the moment, and perhaps people are not feeling what they want to be feeling at the time. I don't think people are fed up. I think a lot of the numbers describe more of a hesitancy. Like, for example, there's areas where the folks that should have gone Republican historically were kind of like undecided in our poll, right? And what does that mean? That means that they don't really want to go left, but they're unsure about going right. And I think that's where we are now, where it's not a 5-alarm fire that's like, hey, we need to panic, but there's warning signs there that are telling us Hispanics are concerned with things that are happening. Independents are concerned, or at least unsure with everything. And I think that's a broader thing. Beyond that, you can get into the local politics of it and the candidates themselves, because every race is really about the candidates. And so, you can't compare Trump and DeSantis numbers to a local mayor election because they're not the same people. They don't have the same brand and the same appeal that perhaps, the national figures and the statewide figures have. So it's a little bit of a, you don't want to get caught in that trap where you're making these comparisons that are not exactly fair. But at the same time, it's nothing to ignore. It's something that you definitely need to pay attention on a local level, but also on a national level if you're on the Republican side. And if on the Democrat side, you don't want to, it's not the whirlwind victory that some are claiming either. So it's somewhere in the middle. Yeah, I think there's a lot yet to be seen. I think there's a lot of good policies that are going into effect that were passed this year and work. You can't reverse 4 years of work from one administration in 1 year of the next, as fast as this one tries to move. And so you're going to see a lot of things, hopefully, that begin to materialize next year. But a lot's going to affect, how the economy does, and not just Wall Street, but Main Street, and how the ACA thing, I think, is an issue, particularly with this subset of the population, because it's going to affect a lot of people. So how that gets handled in the next couple of weeks, and what resolution comes to that, so that come January 1st, you don't have millions of people with substantially higher or unaffordable health care. I think that creates that's a real issue. And then immigration, where you're still seeing things, and it's not as much of a there's not so much hysteria like there was maybe 3 months ago, but still it's a major factor, and especially in the Hispanic population. Outside of that, I think you still see it. I think independents are the ones that are going to be the most affected by that. Why? Because they're independent, because they sway. They're not loyal. One thing that we did see: Republicans held court, Democrats held court. Like, there's no major shifting. It's not like Republicans are running away from the party or and moving left or anything like that. You're seeing the middle, which is always fluid. You're seeing that shift a little bit. But I think those major issues are probably the key. Obviously, economy, I think, for as long as I've been around, is always first, one way or another. It's people's pocketbook is really important to them, because that's what they have to deal with on a daily basis. So I think that's going to be a major sticking point. And then what gets handled with, like I said, I think ACA is a big topic. I think, for Hispanics anyways, the Venezuela topic, how that gets handled. And I think beyond the Hispanic community, if we get into a war with Venezuela, that is not a simple, hey, Maduro leaves and all of a sudden everything's okay and it's quick. If that becomes a bigger issue, that's something that could potentially affect folks down the line, and that's nationwide. I don't think that would be every demographic, just because it's a war. I'm not going to say like the Middle East, but it's something new that gets started, and there's already a lot happening. I mean, this year has felt like a whirlwind. I think in terms of everything that's happened and how fast things have happened.
Yeah, I think no one can deny that. There's so many issues going around domestically, but also internationally. You've mentioned wars in Ukraine, Israel and Hamas, also the discussion about the economy, trade, tariffs, immigration, Venezuela. Without a doubt, politicians are going to be looking at the data. They're going to be listening to their constituents. They're going to be looking at polling to understand what are those top priorities from the American public ahead of that 2026 election. I do want to thank again Orlando Cecilia from National Victory Strategies for joining us today. I also want to thank our audience for tuning in. Again, this has been The Game, the show where we go play by play, analyzing the game of politics.